Okay, so Elena has decided to go with a doctor and to have a birth doula with her. So what happened next? You had your first appointment at 10 or 12 weeks. What happened next?
So basically first appointment and the end of your first trimester.
Right.
Next one, second trimester, you have one appointment every 4 weeks.
Every 4 weeks, okay.
After that, every 3 weeks, like it will be in the end of second trimester. In 32 weeks, you start to visit your doctor every 2 weeks. And in the last 6 weeks of your pregnancy, you will visit your doctor every week.
Okay.
So if you have a lot of questions,
you can ask.
Yeah. And also normally they do like 3 sonograms during your pregnancy, 3 or 4.
Perfect. Elena, so what kind of tests did you have to go through during your pregnancy?
So in your first visit, you will do genetic test for your baby, and it should be done by 10-12 weeks. After 12 weeks, they're not covered by insurance.
Okay.
And it's up to you. So we missed that test.
Oh, okay.
Because I came like in 30 weeks to my doctor. I really want to see this doctor, and he was really busy, and that's why we missed 1 week. And they can't do genetic test, so we can do by ourselves, but insurance not covered. Insurance will be covered if you pregnant, if you're 35 years old or older. Insurance will be covered. I'm 31, and they suggest to do by 12 weeks, and after that they say it's up to you.
Right. Right. Because you don't have like a high risk pregnancy.
Yes, exactly. They explain like this. In every appointment, when you go to the doctor, you do your urine test. In 27 weeks of your pregnancy, you will do a glucose test. It's very important. For me, it was really important because my mom and dad have sugar diabetes, and they really worried it would be spike of sugar
during pregnancy.
Yes, but it was normal. But in 27, 26 weeks of pregnancy, they will check.
Okay, so as a doula, I can explain a little more about this test. A lot of times women are recommended to do genetic testing, which is fine to do, again, if covered by insurance, but I would suggest to think of the following. Usually if the test, there is no test that guarantees that your baby has any kind of problems. So it will just show the risk of
percentage.
Yeah, the percentage exactly, like how many percent the risk that you have a baby with some kind of problems. And in that case, still, I would recommend to think, are you going to do abortion at this moment? Or are you still going to keep the baby? In case your answer is, I'm keeping the baby anyway, I don't think it's even necessary to do those tests, because you're not going to make any decisions based on those tests. You are just going to be stressed. During my pregnancy 7 years ago, I had this genetic testing done, and it showed a high-risk pregnancy. And I remember myself like crying like crazy and thinking what I'm going to do, like my baby showing high risk of genetics problems, and I could feel her like moving, and so it was like so hard on me. And at one day I just woke up and realized I'm not going to do anything about it, like because they told me like, okay, we do amniocentesis and we'll define more if that is a real problem or not. And it was my first pregnancy, so I didn't want to take a risk of it being like interrupted or like having any troubles there. So I decided not to go with it, like not to do it, because what was the sense? I mean, There was nothing that I was going to do. So unless you really want to make sure that that your baby is not having any kind of genetic problems, it's up to you to decide. But just think of this before doing any further testing.
And you have a beautiful daughter.
And I have a beautiful daughter. Yeah, I mean, that's the chance.
That's why we didn't do this test, because we was late and it's not covered insurance. We don't mind to do, but we was late.
But you love this baby anyway already.
Yeah,
So.
and we decided what we will do when we know like 15% of something.
What are you going to do with this information? Exactly.
Yeah, exactly. What do you do with this information? Like some percentage, like something. How you will be feel during the next 6 months.
Yeah.
So if you
so
don't,
just let it go.
Yes.
The second test that Elena had to do during her pregnancy was glucose testing, and it's very important to do, especially if you have like history of diabetes in your family. Yet a lot of women have gestational diabetes, and it does influence your pregnancy in a lot of ways. Yet most women manage to have normal pregnancy, normal birth. So what I would recommend, and what I do recommend to women I work with as a doula, is don't get stressed, even if your tests show that you have a high risk or your sugar levels are not within the norm. What they will usually suggest is a test, and if there's a problem, again, don't get stressed, don't start panicking. You'll be under precise control of your doctors, and they'll make sure that you feel fine during pregnancy, and in case you have some complications like blood pressure, they'll make sure that you give birth in time. Sometimes they have to induce you a little earlier, but yet just understand that you are under good control here, and that everything is going to be okay with you and with your baby. So usually one more test that they suggest to do during pregnancy is strep test. Did you have to go to strep test, Elena?
Yes,
yeah. So what happens with this test? They're usually done with every woman who is pregnant and expecting a baby. So in case you do have a positive strep test, it's pretty normal to have it during pregnancy. A lot of women experience this just because of some kind of imbalance in your body. And this information will be useful to provide to your healthcare provider at labor, just to make sure that they watch your baby precisely and make sure that the baby is okay. But generally, it's nothing to be stressed about.
Yeah.
So, Elena, tell me a little more, like when did you have your last ultrasound, and do you know, like, if your baby's hands down by this time?
Yeah. Doctor told me that baby can make a turn after 30 weeks of pregnancy.
Okay.
And we did our last ultrasound in 35 weeks. And my doctor confirms that my baby make a turn, so head down and we're ready to go.
Right.
It usually doing last ultrasound to confirm that. After that, if they feel something, they will do double check and do another ultrasound. But right now, after 30 weeks of my sonogram, after like every week of my visit to my doctor, they just check heart beating of my baby. And
that's all they do, basically.
Yeah.
Right. So I just talked to midwife about why they offer just a few ultrasounds during your pregnancy, and why they don't usually do the ultrasound right before birth. To make sure like that the baby is positioned correctly. So usually, unless you have any kind of problems with your pregnancy, they suggest really, like, how many did you have, Elena?
I have three. Some people do 4.
So maximum you would have is 4 ultrasounds. So if you want to say hi to your baby, just get ready for those ultrasounds. Otherwise, wait to meet the baby after your labor. Yet the midwife told me that the reason they are not doing ultrasound at birth or right before birth is because they can actually do the belly mapping and feel where the baby's head is and make sure that the baby is positioned correctly. Also, in case the baby is like on one side or on the other side, your doula can help you in labor to make sure that you take the right positions to help the baby turn slowly in labor. So, and what happens is usually babies do turn during your contractions to make sure that they go heads down and to make sure that labor goes smooth.